Our next presenter is Dr. Megan Perry. She is Professor of Anthropology and Rivers Distinguished Professor of International Studies at East Carolina University. She received her PhD from the University of New Mexico. Her primary research interests involve investigating human skeleton remains to assess ancient disease, diet, and mobility patterns, in addition to mortuary practices of ancient populations in 1st to 6th century Jordan. Her bioarchaeological research at Petra focuses on how one neighborhood in the ancient city adapted to their increasingly urban environment through evidence of physiological stress, isotopic evidence of diet and migration, population demography, and sources of the site's most important resource, water. Dr. Perry has been working on archaeological projects in Jordan for over 30 years, and she is on the board of trustees of the American Center of Research in Amman, Jordan. The title of her topic today, Interfacing with Our Elders, Aging and Health in Petra.
Good afternoon, everyone. Thank you for coming to the Archaeology Discovery Week. So I just want to warn, of course, this is a bioarchaeology talk, that we will have photographs of human remains and drawings of human remains in this talk, which is okay under Department of Antiquities laws. Archaeological investigations of different life stages in the past has neglected both the beginning and the end of life, infants and children and elderly. But over the past 20 years, the archaeology of childhood has expanded to become a critical research area, which has reframed the way we, as most of us are adults, think about material culture and the behaviors of children and how this may manifest in the archaeological record. Now, the presence of children is most readily apparent by their physical remains. The ability to estimate the age of children based on the stage of growth of their teeth and bones provides a detailed understanding of how they move through from the neonatal period to childhood and into adolescence. On the other hand, investigations into older individuals at archaeological sites is largely hindered by methodological limitations in estimating the age of skeletonized individuals beyond about 50 or 60 years, depending on the method you're using. However, just as understanding the social roles of children in the past is important, so too is uncovering these roles in the elderly population. They are often the ones who are revered members of society, as keepers of tradition, as purveyors of knowledge, and those helping assist with practical tasks such as caretaking of children or household duties. As bodies accumulate molecular and cellular damage, these social roles and expectations can change throughout even old age. In addition, these biological changes can be very localized, not only in the body, but also between aging bodies and from society to society. So we really need to understand what aging means and what it looks like in different cultural and historical contexts. Now, the recent refinement and validation of one aging method has provided a new path for estimating the ages of older individuals. I forgot to mention something on the graph that I have here. So you can see this is one of the problems, as this is comparing skeletal age, which is summary age, and real age of people who have known ages that are in reference collections. And you can kind of see as you're looking at older and older individuals, there's a bigger range of skeletal age that they can be attributed to. So that's sort of the problem, is that nobody really ages in a very predictable manner after, about 30 years of age. Okay. So the recent refinement and validation of one aging technique has provided a new path for estimating the age of older individuals, tooth cementum annulation, or TCA. This can overcome the lack of specificity of most adult aging methods. Here, we apply TCA, sometimes referred to as cementochronology, to identify elders over 60 years of age in Petra and through mortuary treatment and life history, begin to understand what it's like to get old as a Nabatean. Now, I should mention that the data used in this paper was collected as part of one of my former graduate students' MA theses. Her name is Acacia Probst. She's now a PhD student at McMaster University in Ontario. So she's the one who collected the initial cementochronology data, and I'm just utilizing it here in this talk. From the late 2nd century BC until the early 2nd century AD, a northern sector of Petra was used as a cemetery for a group of individuals linked primarily by kinship. Now, these were excavated from 2012 to 2016. The project was directed by myself and the late S. Thomas Parker, and it contained a minimum of 121 individuals based on our inventory, as well as a number of artifacts and that sort of thing. So, no, the tomb excavated under the CNEA is not the first time that skeletal remains were found in Petra, according to the Discovery Channel. Challenges we face studying the burials in these tombs is that many of the remains are commingled and fragmented, which is why I have these pictures here. You see a lot of the more sophisticated methods that have been established for estimating the age by looking at different parts of the skeleton require you knowing which bones go together, in one individual. So we aren't really able to do that with commingled and fragmented remains. So age estimation of skeletonized individuals is based on stages of growth or stages of degeneration. Age estimation of subadults or non-adults is how we refer to people who haven't finished complete skeletal growth, is typically based on 3 observations, which varies somewhat based on the stage of growth they're in: dental formation and eruption, long bone length, and the fusion of growth plates or ossification centers. Dental formation is generally the most accurate. The other variables can be affected somewhat by environmental factors such as malnutrition or infectious disease. Basically, those will slow down growth, and the child will be shorter kind of than they should be for their age due to those external factors. But once skeletal growth has completed, generally in the late teens to early 20s, age estimation relies on phases of skeletal degeneration, particularly in the pelvis, the area of the pubic symphysis here. Look at the face of the pubic symphysis, and this is sort of the types of things we'd be looking at. This is the youngest individual, this is the oldest. And the other area we look at is the auricular surface, which is the joint between the sacrum in the back of your pelvic girdle and your ilium of your pelvis. That surface also changes with age. And they are less accurate, as a person ages, as I mentioned, because we all degenerate slightly differently based on things like activity levels, injuries, genetics, even biological sex. So the reason why these 2 areas are used is because they vary the least out of other parts of the body. And they tend to be a little more rigid than the other joints. So there tends to be a little less variation, although, as I mentioned, we still can't really estimate someone with any accuracy beyond 50 or 60 years. So as a result of this methodological issue, we're not able to differentiate between like a 65-year-old and an 80-year-old based on their skeleton. And these 2 individuals actually have very different roles in society due to their different ages and perhaps different abilities and that kind of thing. So we're also not really able to see how diseases would impact people as they move through senescence, as they get older and older, or identify health factors that could mean that they actually end up living longer than other individuals. So we're hoping that the TCA method would be something that can sort of improve upon our inability to really reliably estimate the age of older skeletal individuals. So this method really involves embedding the tooth in resin and sectioning the tooth with a slow-speed saw. And basically what we'd be looking at are these layers of what's called cementum. See right here? Cementum is the material on the outer layer of the tooth root. And every year, annually, these light and dark bands get laid down on the surface of the tooth root. So it's essentially kind of like tree rings, right? And so over the past 20 years, this method has really been refined and has been tested. Validity tests have shown that, with known age samples, that there's about 87% correlation between the tooth-related age and their actual age. So it's really actually pretty good. It's not 100%, nothing's 100% in skeletal biology, but this is pretty close. Basically, after we do the thin section, we sand these down to about 100 micrometers thick, image them with a polarizing microscope, which you see here, count the cementum layers, and that's the most difficult part. As you can imagine, we have to really enhance the images in programs like Adobe Photoshop to really be able to see these incremental lines. And then what we do is we add our count of cementum lines, of cementum bands, to the age that that portion of the tooth was likely forming. So for example, if we have this middle bar here, that's the section that we took. We know in that tooth that the root is about a half complete, and the age of that portion of the tooth forming is about 5.5 to 7.5 years of age. So basically just add that to 58, our cementum count, and our final age estimation in this case would be 63.5 to 65.5 years of age. So that's basically how the method works. When possible, we try to do multiple teeth or multiple sections per individual to sort of test to see how much error there will be in counting those cementum annuli. And I'll talk about a little bit about this toward the end of the paper. So basically, we've got, this is, one of the things we're basically able to look at is the age at death mortality profile of these individuals from the tombs. When we are able to estimate the age of about 66 individuals, now, this is the age at death profile here of the Petra, just the blue line here. And basically what this, we would compare this to what we would kind of expect with an age-specific mortality rate in a normal cemetery population. Now, cemeteries are attritional samples. That is, people get added to them over time, right? It's not like a mass casualty incident where you have a bunch of people across a segment of a population dying at one time, right? These people get added to the cemetery over time, and when you might end up in the cemetery, that is when you might die, can vary. The likelihood of that happening varies based on age, right? So most of what's being blocked off here, unfortunately, is what happens in under 20 years of age. So infants, normally the infant mortality rate is very high, then drops down, and throughout your later adolescence, adulthood, young adulthood, you have a low chance of death. Then it begins increasing as you get older, right? And then it kind of drops off, basically because you have fewer and fewer people living past a certain age. Now with Petra, ours would essentially look like this. This is from looking at 20 years of age and older, except we have this really weird peak here about at 30 to 34 years of age. So here is, if this line was actually the way the age at death mortality pattern went, it would be more like this, right? And the reason why I have it blocked off, because we're really only looking at people over the age of 20. We're not looking at infants at this time. So one of the things that can happen is, and this is something that a lot of people might not realize, is that this kind of age at death mortality curve actually doesn't reflect mortality in a community as much as it reflects population instability. So particularly fertility. So if there's an increase in fertility, for example, that's gonna really mess with your age at death mortality profile. All of a sudden, for example, you'll have tons of infant deaths because there's more infants, right? If more and more people are having babies. It's also things like emigration and immigration can affect this. So basically any type of population growth or decline, okay? So we wanted to look at whether or not this peak at about 30 years was there some kind of disease event that happened that seems to be killing off 30-year-olds, which isn't really that likely. So we ran what's called a hazard model. So a hazard model is something that insurance agencies use for calculating like what your premium's going to be. So they figure out, especially for life insurance, right? They figure out what's your chance of mortality over the next 5 years or whatever, based on what they know about mortality in the population you're living in. And so this is one statistical method to try to control for the impact of the population instability. So we ran a Gumpert-Maycam mortality model here to see if, and ran it with parameters of normal, like population instability. Is the population growing by 3%, or is the population decreasing by 3%? And we found that, in fact, the model seems to fit best a population growing at 3% per year, so that peak in deaths at 30 years of age is likely due to people moving into the community of about that age. It's not due to some disease that seems to affect people who are 30 years old or so. And basically this hazard model points out that the average age of death by 20 years is 41.3 years of age. And the Kaplan-Meier survivorship curve, which is just another way of looking at this, but instead you're looking at your chance of survivorship to the next year, not your hazard of death, is also very, very similar. It basically says if you reach 25 years of age, or 20 years of age, half of those individuals who reach 20 years of age will reach at least 45 years of age. So this told us that people were definitely living longer at Petra, but how many people did we see that were living past 60 years of age? Okay. So that's kind of laying the groundwork, right? So what do we know about what it was like to age in Nebatia? Well, not really anything. So we do know from the region that age was not always conceptualized as years since birth. And people have noticed that many ages on funerary inscriptions seem to be rounded to the nearest 5 or 10 years. So there's some, wiggle room there in terms of how people thought about age. We do know from the Greek writings of Diodorus, who talks about older individuals using a word, presbytery, which basically refers to not only members, elders in the church, later on under the age of Christianity, but in earlier Greek, before Christianity became the major religion in the empire, it just referred to an honored or privileged elder. And they talk about, use this word in talking about Nabateans, that basically is the first one is, what happens to older men in moments of crisis, right? They're kind of left behind with the women and children, presumably because they're rather frail. But the latter quote talks about them as valued elders being sent as emissaries to establish peace. So we kind of see this dual image of people who are older in Nabatean society. And it not only classifies perhaps their frailty, but also their role as esteemed elders. But it doesn't illuminate how or even if this honorific relates to chronological age, right? Nor does it talk about if women, presumably these are men, were ascribed to similar achieved statuses as men. Excuse me. In addition, these are kind of outsider perceptions of Nebatia, right? This is written by someone who is not Nabatean, talking about Nabatean elders. Would the Nabateans have considered them old? Well, possibly because they are undergoing behaviors that are sort of different from the rest of the population, are being sort of singled out. So it's presumably they would be considering them older as well, in the same way that the person who Diodorus was speaking to about this incident was talking about them. So this idea of acquired status due to age extends to other artifactual evidence associated with Petra. Bjorn Anderson, who's another scholar of Nebatia, he had carefully assessed Nabatean coinage, and he identified a couple leaders living well over 70 years of age. And interestingly, royal women were depicted often alongside their ruling brother or son, or husband on coinage, suggesting that they were similarly respected by Nabatean society as they grew older. But we don't really have much evidence about elderly in Nabatea, so that's hopefully the skeletal remains will sort of help fill in these gaps. So who are the elderly buried on the North Ridge? Now, not really knowing who exactly, like based on chronological age, who would be considered old, we used a rather arbitrary cutoff of 60 years of age. I kind of don't want to hear it because I know, like, I'm 55, right? That's very close. I'm not elderly, but we wanted to sort of establish a cutoff. So the average age of our post-60-year-old individuals is 65.5 years, and I was kind of surprised that only one individual was actually older than 70, based on our TCA age estimation technique. Two of these individuals from tomb B4, that's what the B4 means, were articulated, mostly complete skeletons, and the rest were from commingled deposits, the ones down here. And so it's more difficult to associate those teeth that produce the age with other bones in the skeleton that can tell us more about their lives. So for a lot of this, I'm going to focus on these first two individuals. And in addition, we assess the assemblage for individuals who likely would have been considered elderly based on age-related degenerative changes in the skeleton. So we included another articulated burial from tomb F1, this tomb F130 individual 1, who had a pelvic age of 60 plus years, but she also had significant osteoporosis that caused a lot of damage to her skeleton, which we'll talk about in a bit. So what can we tell about the health of, in particular, these three articulated individuals? So the one individual from tomb B4, B422, which was located right here, he was laid out on the floor of the tomb. The other individual from tomb B4 is B417 here. That's the other elderly individual. So they're both laid out kind of on the floor of the chamber tomb. He had vertebral degeneration, so breakdown of the vertebrae of the backbone, and arthritis in the backbone, to the point that there were two vertebrae that were actually fused together in the thoracic spine. And then osteoarthritis in the right arm and the left wrist. So this is not really a unique pattern in Petra. We see a lot of arthritis, especially hand and wrist arthritis, and so and vertebral degeneration as well. So this tells us that this older individual at Petra essentially lived similar lives as those who died at younger ages. There's nothing really more or less healthy about them. They weren't engaged in maybe different activities, right? They kind of look like the rest of the population. So there doesn't seem to be anything in particular that said, that can tell us why they lived a little bit longer. Now, the 60-plus-year-old individuals from tomb F1 suffered from a fracture of the femoral neck, basically a hip fracture. And it was right at the base of the neck of the femoral neck and head, right here. This is her other vertebra that looks, has sort of a normal neck shaft angle. Here you can see it's kind of compressed. The femoral head is pointing down, not up, as it should, to articulate with your hip. And there's actually some healing there, right? So there's the edges of the actual fracture area are kind of rounded, and there's some adhesion of the broken off piece to the rest of the femur. So what this tells us is that she actually lived a little bit past the time that she had this accident. But this is a very tragic kind of hip fracture because it's very difficult to stabilize this type of fracture so that will heal without surgical intervention. Today you would have surgery on it to correct it and put a pin in there. So the head would be displaced and the joint would be very unstable. And also this type of fracture clinically is related to damage to the blood vessels, which could result in death of the bone of the femoral head. And it kind of is hard to see probably for you, but there's like little porous areas along the femoral head that might be the beginnings of necrosis, of the bone dying. But she did, as I said, probably did live a few weeks after this accident happened. But that wasn't the only thing. This is the one actually that I was like, oh my goodness, I had to show my what am I trying to say, my bone doctor, right? So this is the tibia. So this is like the lower big bone in your lower leg. This is the part where the knee joint is, right, where your femur sits on top of the tibia like this. And you can see this most distinctly here. This is supposed to basically come across and be right up here somewhere. And for whatever reason, the knee joint received such compressive force that the femur was sort of driven down into the tibia, causing this fracture. It's basically kind of crushed part of the upper part of the tibia. And it's on both sides. It's just more distinct that you can see it here. Here's another view of the other side of her tibia. And there's these areas of resorption on the joint surface, and you can see lots of arthritis. Like, look at that. So she was hurting before then, right? And then she apparently had a fall that not only caused the hip fracture, but also this knee fracture, which generally results from axial forces kind of going up the leg. So it almost seems like she fell, her left leg received the brunt of the force of her fall, then fracturing the knee and then causing the femoral neck fracture as well. And what's interesting is, I started kind of looking into, okay, I know this woman was immobile in the last, few months of her life, possibly last few weeks, but it's not really clear what she died from. So you kind of think, well, of course she died from a femoral neck fracture. Well, actually, no. Only about 15% of people who have hip fractures actually die from like the hip fracture, like infection or other issues related to their bone health. She has no evidence of infection around either of the fracture sites, so there was no sign that she, had any kind of systemic infection that would cause, maybe sepsis or something like that. Excuse me. So the clinical evidence does say that, like in the first 3 months after a hip fracture, people tend to die from comorbidities. So basically, diseases that they'd already had, but then like cancer or coronary heart disease, but then the fracture just kind of, their body is not sort of able to hold things together anymore. Okay, so what about mortuary treatment? Were these people treated differently in death? Well, it seems like that's not really the case. They were treated pretty much like everyone else they were buried with. Two individuals in tomb B5 were included with the rest of most likely their kin in a receptacle that basically what they would do is they would gather the bodies after they decompose, gather the bones, and put them in this receptacle with other individuals who had been originally buried in that tomb. So this had, I think the M&I in that receptacle was about 25 people. So they were just included with the rest of their kin group in that mortuary context. The two individuals in B4 were laid out on the surface of the ground, as I mentioned, but that's not really any different than any of the other individuals that were in tomb B4. In F1, the older woman with those fractures, she was actually buried in this rectangular floor shaft grave with two other individuals. She was on top, then there was a 45 to 49-year-old individual, and then a 7 to 9-year-old child. So again, not really separated out, not really treated any differently after death. Unfortunately, the individuals from tomb B6 and tomb B7 were too disturbed to be able to assess anything about the mortuary behavior associated with their burials. Now, what about artifacts as well? Are there any different artifacts that are left in the graves with these individuals? Well, the person buried in tomb B4, B422, did have one artifact that was clearly associated with him. It's a 1st century AD unguentarium, which is used for perfumed oils. These are ubiquitous in Nabatean mortuary context. The perfumed oils were basically one of the products of the incense and myrrh that were carted to Petra, and they would make these perfumed oils and then ship them out to other areas for trade. But they also included them in the tombs. The other interesting thing with these two individuals is the other objects within their burial context were all game pieces. So we had a lot of astraguli, right? And these astraguli are worked. These are sheep, goat, like knuckle bones, basically. So they played knuckle bones with these. And they were shaved down on either side in order to prepare them for playing with knuckle bones, I guess, so they'd fall, true onto the hard surface. This round stone sphere, I'm not really sure what game that could have been used for, and then a die that looks just like the dice that we have today. And in all of these, there were broken ceramics, but I'm focusing more on the small finds and the complete objects that were found with these individuals. Now, in the other tombs, we have a lot of diversity. And the thing is, the diversity that is seen with the older individuals in these tombs is kind of what we see across Petra in general in terms of the artifacts that were buried with the individuals, the deceased individuals. So F-130, we found a lot of beads, other decorative objects, and these could be associated with the older individual or any of the other two individuals she was buried with. It's not clear because they can easily filter down through the sand. We also had a couple coins of Aretas IV in there as well, the king. So for those who were here yesterday, we talked a lot about Aretas. In B733 and 34, in those contexts that had older individuals, they were very diverse in terms of the artifact assemblages. We have a nice 2nd century BC unguentarium, a little incense burner. We have a little votive of a goddess, probably the goddess Alat, and some clay figurines, and more astraguli, more of those knuckle bones. We had 22 of those. So it's really curious, why would you be burying astraguli that are used for playing knuckle bones with the deceased? It's not something, we can make assumptions, right? That they're for the afterlife, or maybe people would while away their time while they were burying the dead by playing knuckle bones. Maybe it was part of the mortuary feasting event. It's not really clear, right? So we don't know why those are in there. The other interesting thing is the individuals in tomb B6, the artifacts that were included in their context are mostly these coffin studs. These are copper alloy studs, and you can see some of them have actually like an iron little tack coming down the center of them. You can especially see it in this one down here. And so those would be, and we found some in situ, like in the coffin wood that was used to inter some of these individuals. The wood is made out of juniper, and then they would have probably some kind of decoration on the wooden coffin using these studs that they would sort of drive into the wood. Unfortunately, we don't have any evidence of what that decoration looked like. Kind of weirdly, people used to do the same thing in the U.S., in the colonial U.S. in the 1800s, as they would have coffins. Actually, some of the stuff I've excavated in North Carolina, we found when I was like, oh my gosh, this is just like the Nabateans, where they had like coffin studs that had it was a 1.5-year-old child, and they had the studs spelling out their initials and how old they were when they died. So that was kind of cool. So I don't know if it would be something similar or just some kind of decoration. But we don't really find these in every tomb. So that's also kind of interesting. We do have evidence of coffin wood in all the tombs pretty much, but not all of them use these studs for decoration. So I'm not really sure if it's something that was certain families really enjoyed or it was important to them to include. If it was a temporal thing, maybe it was something they did in the early 2nd century, BC, or in the late 2nd century BC, and then by the 1st century AD they stopped. So it's not really clear again what was the reason for some of people having these and some people not. There doesn't seem to be any real pattern. Okay, so the artifact assemblages then did differ, but again, that's not really, between each older individual, but that's not really different from any of the other individuals in Petra. So What's unfortunate is, kind of as I finished looking at this stuff, the commingling and the fragmentation of the burials in the North Ridge make it really difficult to sort of systematically explore the life history of these individuals. And even with some, their mortuary treatment. There's some more recent looting that has disturbed the remains, but we were able to sort of tell if it was being commingled or mixed up due to mortuary practices or due to looting. We could kind of differentiate that a little bit through careful excavation. But the similarity of the ages of these individuals, right, they were all basically between 60 and 71.5, made it really difficult to track any changes in health across senescence, right, across their old age period. And in fact, I was kind of surprised there was only one person that was over 70 years of age. But we do know that they're incorporated with the rest of their kin in the burial context, so in the same way, right? There was no special combination made to highlight their advanced age. But we would suggest they were probably considered, individuals with some kind of achieved status based on their life experiences and knowledge, and they could be considered frail, and I'm pretty sure the woman from tomb F1 was considered frail, but we don't really have a clear picture still. Now, the reason why I found the lack of this 70-plus-year-old individual surprising is because we know from funerary inscriptions, despite their sort of problems, is that there are a lot of people at other sites that are contemporary and nearby that lived well past 70, and well past 60 even. So there's one site in the southern end of the Dead Sea. It's actually a conglomeration of a number of sites called Gor Safi, and there are a number of funerary inscriptions that have been recovered over the years from this area in Hebrew, in Aramaic, and in Greek, and I think there are a couple that are actually in Nabatean as well. And of the 333 that have been documented that list the age of death, there are actually more, but not all of them list the actual age of death. 57 of them are people who are over the age of 60, and we even have people well into their 70s and 80s, and even up to 108 years of age, supposedly. So who knows? Now, unfortunately, these funerary stelae have long been disassociated from the grave that they marked. So we're not able to go into the grave, excavate the skeleton, and sort of see skeletally what their age would be. And it kind of makes me wonder if, maybe there are older individuals here because to really honor someone, to really enhance the fact that they are a respected individual, that maybe their age was inflated when they were buried, right? So that, maybe they were, 65, but because they had such esteem in the community and they were considered such a respected individual, they kind of, since the chronological age was sort of loose, that they said, oh, they're actually 70, on the tombstone. So this is I made a survivorship curve based on the Gor Safi remains of funerary inscription, over 20 years of age, and you can see the Petra one, which I should have put here right next to it, but that dropped off around 70, and here you can see it extends that people had, still had chance of survivorship well into their 90s, right? So that's kind of more what you'd expect to see. And so I'm not really sure why we're having two totally different pictures here, right? Is Petra, this is only one community in Petra. This is only five tombs from probably one family. Do we have diversity across Petra where individuals did live much longer than what we have on the North Ridge that might reflect more what we see in Gor Safi, or the Gor Safi ages biased, right, from people not really being exact in terms of how old someone is. I mean, you kind of think about it, you always the oldest person, in the world is 125, but then it turns out they're actually from a community that they don't really know when she was born or he, and they don't really, have that kind of documentation, and so everyone kind of thinks of them as being really old, and maybe they're actually only 102 or something like that, which is still really old, but, The other thing we were thinking about, well, is it due to the methodological limitations of this method, right? The precision in other studies, the precision declines as the individual gets older. So yes, we have these annual cementum lines that get laid down, but if you're undergoing, we don't really know if like you're sick or you're, if you have, other physiological things going on, how does that affect annuli development? So that's something we don't really know, and those factors kind of build up as people get older, so the number of annuli they have might become less reflective of their actual age as they get older. Which is possible. There's also the issue with intra-individual error in terms of like one person counts the lines, they might get something wildly different than someone else who counts the same lines. So we wanted to, people are trying to overcome this. There's like, people are developing AI models and stuff like that to be able to look at a slide of cementum lines and be able to sort of accurately count them. So we'll see what happens with that. What we do see here is like we compared, as I mentioned before, we tend to take multiple samples from each individual. And so I can look at the different cementum counts and the ages that were derived from that across different samples from one person and compare them to see if there's a huge difference, right? If we see a huge difference, then we could say something like, oh, there's some bias here in terms of, inter-individual error or something. And so I kind of graphed out the average difference in the TCA-based age in years between the different samples from each, from a single individual, and the age at death, basically what their age of death was estimated at. And you would expect, if there's a relationship between, as people get older, the error gets wider, right? You expect sort of the dots to go along a line like this, but they don't at all, right? So in fact, there's really no difference if you're older or younger, how much difference there is between the different sections that were taken of the tooth and the annuli counts that resulted from that. So what that told us is that there's probably not a factor here with age at death. But in the future, we can probably observe other skeletal elements that are linked to old age to try to get a better picture of what old age was like in Petra.